Hi, what's up guys? Welcome back to my channel, and for today's video I'm going to share several terms or abbreviations that we use in the United Kingdom that you might not be familiar with. Please don't forget to click like and subscribe so that you'll be updated every time that I upload a new video. This will be a rather quick video. For today's video, I've thought about 23 things or abbreviations or terms we use in my trust. So number one is this symbol, the hashtag symbol, which at first I thought it was just a hashtag. Okay, so this actually means fracture. The first time I saw this was in the theater list when I was looking at the team brief, and I saw next to the patient's name is hashtag NOF. So I didn't know what is hashtag. So back home we use FX to indicate fracture. Number two, UNE. UNE stands for urea and electrolytes, but they just say bloods. For example, if you're giving handover to the ward nurse and then she'll just ask, okay, what time? Oh, will there be bloods in the morning? Then number three, probably you've heard before, TWOC. TWOC, which is TWOC, which literally stands for trial without catheter, and this is not actually a trial, but removal of catheter. So back home, its equivalent, I think, is discontinued catheter after bladder training. I don't know why they call it trial without catheter. Maybe, oh, let's try you without the catheter, so let's take it off. Number four, ABX. This confused me during my first few days because it usually is written as IV ABX or simply ABX. I understand IV, it's intravenous, but I don't know what is ABX. So this actually stands for antibiotics. Here they write IV ABX to continue as the plan of care, and then you'll just see the list of the antibiotics in the prescription chart that was prescribed or in the discharge summary that were prescribed. Number five, iGel. So this is not an actual gel. This is a brand of an LMA. If you don't know LMA is a laryngeal mask airway. It's a supraglottic airway that we use for easier airway maintenance during general anesthesia. So it's a quicker way to provide mechanical breaths to patients while they are completely unconscious. So remember, iGel, it's an LMA, not an actual gel. The first time I heard it before, when I was still a supernumerary, I was trying to look for gels. I thought iGel is the lubricating gel, but turns out it's not. Number six, CCF. CCF is just congestive cardiac failure, or as we are more familiar, CHF, congestive heart failure. Number seven, a bung. You notice the IV cannula if you want to cover it or cap it. So back home, I think we call this cap because you cap the IV cannula, but in theaters they call it bung. I don't think the ward nurses use this term, but each time when I document in my nursing notes, I just write capped. Number eight, Inco pad. You probably know it better as an absorbent pad, but Inco pad, I believe, is from incontinence pad because the patient couldn't control his bowels, so you place this pad under his bottom. First time I heard it in theaters, the anesthetic nurse was looking for an Inco pad and I didn't know where to look because I thought it's a pad. I understand that it's a pad, but I'm not sure if it's a maternity pad or a diaper or I don't know. Number nine, Flowtron. Flowtron is actually an intermittent pneumatic compression boots, which looks like this. So we use this to prevent blood clots as part of our VTE prophylaxis to patients. And speaking of VTE prophylaxis, number 10 is TEDS. TEDS, which stands for Thromboembolus Deterrent Stockings. TEDS. I thought it was a teddy bear. During my early days, when the surgeon asked me to put TEDS on the patient, I thought he was referring to a teddy bear. Back home, we say anti-embolic stockings, which now I realize as a very long thing to say. TEDS is definitely shorter. Approved. Number 11, appendicectomy. Appendicectomy isn't different from appendectomy. It's just excision of an inflamed appendix. That's why it's called appendicectomy, because you're excising the inflamed appendix. You're excising appendicitis, which makes sense. Back home, we just call it appendectomy, but according to dictionary.com, appendicectomy and appendectomy are just the same. Number 12, ERPC. ERPC is evacuation of retained products of conception. So this is a surgical procedure, specifically a gynecological procedure, which is pretty self-explanatory. Number 13 is MUA. MUA is manipulation under anesthesia. I think you are more familiar with the term closed reduction. We understand that closed reduction is performed under IV sedation, which is pretty familiar or pretty similar to MUA. Number 14 is Hartmann procedure or Hartmann surgery, which is just a nickname for proctosigmoidectomy. It's a pretty long procedure. It could last up to 4 or 5 hours depending on the complications or depending on the patient's situation, but it's not related to Hartmann solution, which is a different type of IV fluid, by the way. Number 15 is the word main, which I also saw this in my OET before. Main actually stands for tomorrow. So back home, they usually write this as TOM, Tom. Like for example, bloods Tom, or ultrasound Tom, or discharge Tom. Here they'll say bloods main, antibiotics main, enoxaparin main, something like that. Number 16, E&D. I thought this was an area in the hospital, or this was a part of the hospital, but actually it's eat and drink. Back home, we usually encounter DAT or DAT, diet as tolerated. Number 17 is RESPs. RESPs is short for respirations or respiratory rate or breathing rate or RR. We just call it RR back home, but although RR could also stand for recovery room. Number 18 is in and out catheter, which sometimes we just call intermittent catheter or straight catheter. So here, in and out, because you put it in, you drain the urine and then take it out. So in and out. Creative. Number 19, which is sometimes still confusing, although I've heard this before from other vloggers, is BM, which is not bowel movement, but rather blood sugar. Maybe it's BM because blood sugar monitoring, I don't know. But yeah, BM is blood sugar. It could get really confusing, especially to Filipinos. Number 20, TDS and QDS. TDS is thrice a day and QDS is 4 times a day. These are just a frequency of medications. You will see these in the prescription chart or in the plan of care documentation. Number 21, OP. OP is just osteoporosis. Because OS and OD are left eye and right eye respectively, I thought OP is something to do with the eye. I don't know, but turns out it's just osteoporosis. Number 22, BNF. BNF stands for British National Formulary, which is a reference for all drugs that are given in the UK. So its equivalent back home is our MIMS, our drug reference book. And last on the list, a common term that you will hear, so you will eventually move on, you will eventually embrace or remember this term as OBS, which is short for observation, which we call vital signs back home. So when they say, can you do the OBS? So you're not just going to visually observe the patient, but actually take the TPR. So temperature, pulse, and respiration of the patient, including his saturation and his pain score. So the OBS is part of the news chart that we fill in each time we do our patient rounds. So those are the things that might sound new to you, especially if you came overseas, if you're trained overseas, and you might encounter them at work. I hope that I've shed some light on what they mean. If you're not yet in the UK, I hope I have given you an idea on what are the terms, abbreviations that they use in UK practice. Okay, so that's that for this video. I hope you like it. If you do, please click subscribe. Go visit my channel and see my other videos. Probably you'll like them too. Hope to see you soon. Bye.